All right, I'm Ginille. I'm a cosmetic nurse practitioner. I've been injecting Botox fillers since 2013. If you have questions on anything, please jump in, let me know. We can talk through your hair health, skin health, Botox fillers, all the things. I have 3 medical spas, 2 that are in Los Angeles and 1 in Las Vegas. In our offices, we really focus on treating all skin types, all skin tones, getting you natural looking results. We want it to look like you. We want it to look fresh, never overdone. So if you have anything, let me know. People will also come on here and we'll do virtual consults. I'm only going to be on here a short time today because I got to run and get my kids ready for bed. But yes, in our office, again, we treat all skin types, all skin tones. We focus on natural results. We focus on understanding what's happening beneath the skin, where aging is happening. That's how we inject so that it never looks weird, overdone. We're not spot treating in our office, so we're not just treating a little area here or just the lips. Like, we really are considering the entire face and how it ages. I had a video I posted talking about Botox and the different areas we can treat on the face with Botox. So if you have any questions, please let me know. Can I have more than 1 ml of lip filler if I want to? Yes, you can, if it fits in your lips. I mean, you can totally do whatever you want, but big things to keep in mind are you want to make sure that it's not puffy above the border. You also don't want to lose your shape by doing too much filler over time. So I tell patients, do some, let it chill. You can always add if your lip can maintain it and it's not puffy above the border and it doesn't distort your shape. You know, if it starts to get too much in the lip, there's only going to be space above and that's where the product will go. You don't want that. So don't rush it. Other things to keep in mind when you're doing lip filler are the corners of the mouth. So you don't want to just have like nice juicy lips and then like sad old lady lines. We also want to make sure that the chin is not like super set back, or else your lips will project beyond the chin and will look a little ducky. I have 2 locations in Los Angeles. So I own 3 medical spas. I'm a cosmetic nurse practitioner since 2013. I hear my kids playing over there. And we have 2 in Los Angeles. One is in Mar Vista, one is in Torrance, and then we just opened up in Las Vegas. So we'd love to see you. You can always send a message or you can reach out to our team. The number is at the top of my page. If you call or text us, we can help you with getting seen. I do virtual consults. People will do them here, or we can just do our one-on-one consults. I do in-person consults, and then we have an amazing team. So we really are big on understanding you, your goals, again, considering the full face, how it ages, not just spot treating in the office. And we're very big on skin health and hair health as well. We want to make sure your skin is healthy, and we don't want to just only do Botox and fillers, even though I love that. But like, if your skin, that's the first thing everybody notices. So if your skin is not great, you know, nothing is going to look that great. So we want to make sure everything that we're doing in the office is safe for all skin types and tones. We see a lot of women of color in our office and men. And so the treatments that we do, we have aerolase laser, skin pin microneedling, bio repill, chemical peel, hydrofacial, everything we do, safe for all skin. And you can also combine a lot of these treatments depending on what your concerns are, is what treatments we're going to be picking. And if you have downtime or if you don't want any downtime, that helps us. Would you date a big back? I can't date anybody. I got 3 kids and I've got a husband. So thank you. Okay, I'm glowing. Thank you so much. I actually want to do the bio repill chemical peel tonight. I do it like twice a month. And I feel like that helps my skin glow the most and just helps brighten the skin, and there's no downtime with it. So it's been about 3 weeks since I've done it. I was trying to do it last week, and I didn't get a chance. First timer here, what do you recommend for a first time? So Ashley, if you've never done anything, very first and foremost, I want to focus on your skin health. We want to help just brighten, maintain, make sure you're not having any dark spots, fine lines, pores, texture, acne, scarring. We can try to minimize the appearance of those and then help prevent them. If your skin is healthy and glowing, that's like the best canvas, the best foundation for you to then go and do Botox and filler and like treat signs of aging with injectables if you want. But I think everybody loves to have fresh looking skin. At the very, very least, make sure you're using sunscreen and reapplying. Then from there at home, you can also do a retinoid, retinol, tretinoin, or retin-A. That can help with turning skin cells over faster. It helps with fine lines, pores, skin texture, dark spots, collagen stimulation, acne. And so doing that, and then in the office, we have different skin treatments, again, depending on your skin concerns. So after that, if your skin health is good and you're like, I love the way my skin looks, it's glowing, I don't have any skin concerns, I've been really good about my skincare, or I'm already doing skin treatments, then we can talk about Botox. So very often people will notice like lines in between their eyebrows, lines on their forehead starting to etch in when they make expressions around the eyes. Those are very common areas. Other spots we'll do Botox, if your lip curls in or if you want your lip to look a little fuller, we can do Botox above the upper lip, can do Botox into the chin. If you have dimpling, Botox at the corners of the mouth. If your mouth always pulls down, we can do Botox for TMJ symptoms like clenching, headaches, teeth grinding, jaw pain into the temporalis or masseter muscles, into the neck bands, into here. It'll tighten them, give a little subtle neck lift. So that's Botox. I would say that's secondary after your skin health is healthy, and then your Botox. And then I really love the all natural filler. I'm going to make another video about that. So natural filler made completely from you. We draw your blood, spin it in the centrifuge, we separate out your growth factors, your stem cells, we heat it and cool it, and it makes a gel. Wherever we inject that in the face, it's going to make new collagen over time. So that is a natural way to maintain your collagen, to keep looking like you, and it's never going to look overdone. Guys, I love filler. I love Botox. Look at our patients. Look at their before and afters. Read the reviews on our patients. See the videos they make themselves. They look fresh and they look great and they look like they're aging backwards. But not everybody wants filler and not everybody's a candidate for filler. But everyone can do the natural filler. So yeah, is me making a consultation the first step? So yes, I would book a consultation. You can do that at the top of my page, or if you text the number, the team can help you. Or sometimes people will just jump on here and we'll start the conversation and go through your questions and goals. And during that consult, yes, questions, goals, tips on what to expect, how to prep for treatments. I'm asking you what treatments you've done, what kind of downtime do you have? Are you prepping for events? Are you planning any major like weight loss, weight changes? I'm really thinking about how the face is aging, and that is how that determines the treatments we're doing. So if someone tells me I'm about to go lose 30 pounds, 50 pounds, 100 pounds. Okay, I'm like, hey, you're going to lose fat in your face. We should be thinking about some collagen stimulators. We're talking through all the things. So we ask a lot of questions. Obviously, I yap a lot, but I really want people to make informed decisions and know what we're doing. There's a big reason behind everything we do. It's not random, and it's going to be specific to you and your goals and concerns. So that's why we want to talk through. Natural filler is made completely from your own blood. We draw your blood, we spin it in the centrifuge, just a couple tubes of it. It separates out your growth factors and stem cells, and then we heat it and we cool it so it's thicker, and then we can inject that. And I've done it all over my face. I haven't done any regular, like traditional filler for the past 3 years because I'm still breastfeeding a baby. He's 2. But I've done it my temples, my under eyes, my smile lines, my corners of my mouth, my chin, right here to connect my chin to my jawline. I've done everywhere with it. And I have a lot of patients that treat their whole faces with it, and they like it because it's made from them. You're not going to have allergic reaction to it. You're not going to have any issues. You're not going to have lumps and bumps. Like, it's made from them. It's making new collagen over time. And guys, we are losing collagen starting in our mid-20s. We just keep losing it every year. So this is a nice way to restore collagen completely natural. And patients love that. And I have people that have done it their lip. I've had people who do their whole faces. Most common areas people will come in are for like the under eyes and smile lines. But seriously, a lot of people end up just coming back and maintaining with the natural filler, and they don't even ever go regular filler route. Again, I love traditional filler as well. Thank you, Nettie. God bless you. Thank you, sir, so much for sending love. I love traditional filler. We just want to make sure we're doing it in the right patient, the right area, the right amount, the right product, and that whenever we inject anything, we're considering the full face. We're not just, only treating smile lines. We're not only treating lips. If we just spot treat, guys, I'm like, if I only get rid of your smile lines, it's going to look puffy, bulged out, and you don't want your cheeks looking saggy or the corners of your mouth looking saggy. That's when people spot treat, and it just doesn't look good. I'm sure you have seen people on the street and you're like, oh gosh, I can totally tell she's done work. It's because it's overdone, or they're just treating one area, like they're just doing their lips and their chin is backwards and this is saggy, and their cheeks are overfilled, and then above it their temples are hollow. we want to make sure we're looking at the full face, not just treating one area. Like all these areas run together. If we treat one area, it can impact another area. So we want to think about that when we're doing our treatments. Okay, let me make sure. Natural filler made from your own blood and growth factors. So nothing else is in that tube, and nothing, sorry if you guys, my kids are screaming, nothing else is inside of there, but it's going to help volumize, lift, give some collagen stimulation. It's not as quick as traditional filler. Traditional filler, you can see the results right away. The natural filler, you'll see a little bit, but it's going to kind of go down after the swelling. Gradually, your body's making new collagen over time. If you guys can't hear me, I'll probably get off because those kids are playing this video game right now. After consultation, can we go directly in the start of improving the skin? Yes, Denise. So when we do the consult, so we can talk about you, your skin, your concerns, what treatments you've tried and may have worked or may not have worked, you know, what your downtime is, and then we'll start developing that treatment plan during the consult, and then we give you the pre-care and the post-care so you know what to expect. We just want to make sure the timing is right. You know, if you say, I want to do microneedling, and then you have to be on camera the next day, that wouldn't be so great because you might be a little bit red. So we want to tell you everything about the treatments. And this stuff is also on our website, obviously through a lot of the videos I have. I have to tell, they're loving this game. If you cannot hear me, like put a thumbs down or put something so I can go tell them to be quiet. But yes, from there, we have you start and get ready. We can book your appointment. We just want to make sure you're prepared for it. Okay, I am in New York. I'm not in New York. I'm in Los Angeles. That's where I'm based, but I also have a clinic in Las Vegas. And so I see patients in all three of our offices, and we have entire teams in all three of the offices. So we have other providers. These girls are excellent. They get excellent results. We all have the same philosophy of how we treat to get natural looking results. We all treat all skin types and all skin tones. And you can read the reviews on everybody, like they're so wonderful. Okay, there you can hear me. Thank you. Okay, does Botox really help with platysmal bands? Yes, I have pictures of that. I usually have a bunch of photos that I'll flip through, but I told the kids, I was like, I'm gonna go talk for 15 minutes. You can play your video game, and I'll be in there. Hi, I hope you're doing so good over there. So these are the platysmal bands. You can see them flex on me. Gosh, they're pretty strong. So we have these bands in our neck and the neck muscles. When we Botox here, you won't be able to flex and see those so hard. So then it can help, like this one runs right where the jowl is. And so it kind of help like define along the jawline. It can help tighten the neck. So people will be like, oh my gosh, I felt like I had a swan neck. I look just tighter. Oh, it helped hide my double chin. It's not like getting rid of fat. It's not permanent. It's not a neck surgery. I tell people that, but people like it and they always asked to do it again, or they asked to do more. So yes, you can totally do Botox in your neck. And I just think it helps. You know, a lot of people do their Botox, just their frown, forehead, around the eyes. But I'm like, we're missing the whole, you know, the whole rest of the area that people see, you know, your lower face and your neck as well. Sometimes I look at people and I'm like, oh, wow, your face looks great. But like the neck is like giving away the age. So bring your skincare all the way down when you're doing your sunscreen, when you're doing your retinoid, you know, your Botox. Just consider the full face when we're doing this. I live in Sacramento. How often would I have to come in for upkeep? I have been talking to so many people from Sacramento, and that's where I'm from. I'm from Elk Grove. It's so funny. But I've had multiple people in the past couple of weeks. So I guess all my videos are going there, Denise. And hey, Denise, thanks for always sending me some hearts. Depends on what you're trying to do, Denise. If we're doing filler, I would say plan to come once and then like come in 2 months later so I can see you to fine tune if we want to add any more. I never want to rush this stuff. So I say do some, let it settle, reassess. We can always do more later. Your Botox, you can come between 2 to 3 times a year, depending on the dose, if that even is a concern for you. If it's skin treatments, that's more of a monthly thing, but you know, we might be able to find somewhere over there for you. I'm like, I should make a dang clinic in Sacramento too. All my family's there. Thoughts on Sculptra, Nettie? I like it. Sculptra is a collagen stimulator. We can place that anywhere like temples, mid-face, lower face. You cannot put it in the lips. You cannot put it under the eyes. It gives gradual results. It's not like super overnight and quick. Sometimes I will grab Dilute Radius because I feel like I can see it a little bit faster than the results on Sculptra, but they're both great. And also another collagen stimulator is is the natural filler, so made from the person's blood and growth factors. So those are the 3 collagen stimulators that we have that are FDA approved in the United States to use. But I like it. I use it on my patients. I will only use stuff in the office that I really like. Other than that, I don't even want to like be wasting people's time and money or my time. Okay. What do you recommend for tired eyes? I turned 40, always in screen. I'm noticing tiredness. So Ashley, if you feel like sunken under here, you can consider filler or natural filler. Anybody that says I look tired, they usually are having a little bit of their fat pad that kind of shows, or they've lost a lot of volume. This is me when I was 28, so they feel a little sunken, or they'll feel like the skin looks darker. Sometimes that darkness is caused from sunkenness, from like hollowness. So that's where we use filler or natural filler. To do filler, you have to be a candidate for it. So you want to make sure you don't get puffy. If you cry a lot, if you've got bad allergies, anyone that retains a lot of water around their eyes, I'm like, don't do filler, because filler binds water and it'll look bad. It'll look puffy. It'll look overfilled. Like it doesn't look good. So if you retain water, no regular filler. You can do the natural filler. So that's when we talked about made from your blood, growth factors, and stem cells. Draw your blood, we take out the growth factors and stem cells, we heat it and cool it. We can place it under here. It'll help lift the skin and give some volume, revolumize over time, give new collagen. So that is really helpful. Also, if you have like, oh, I smile and I get these little lines and I don't like those, you can do Botox there. The natural filler, I think, is really great. And then other things, using your sunscreen and your retinoid around the eyes, but moisturize, because the skin is thinner here when you're using your retinoid. Okay, let me see. I'm anemic. Would natural fillers still work? Yes. Well, it depends on like how anemic you are. If you're like severely anemic, I'd be like, hey, don't do this. But if it's like, oh, I'm mildly anemic or some iron deficiency and I can take my iron pills and I'm fine, you should be okay. If it's something like really severe, then I would tread lightly there. Average cost on the natural filler. So we do it in 2 sessions. We have you do 1 session and then come back and retreat that same area. We want to build on that collagen stimulation. So it's a 2 session minimum that you want to do, and you do them about a month apart. It's $25.50 for those 2 sessions. In our membership, it's a little bit cheaper. So they're like $9.50 a session. So members will do that, and a lot of people like the under eyes and smile lines, but I have people that do, and my own self, do their full faces, temples, eyes, smile lines, cheeks, chin, corners of the mouth. I really like it. For sure. Thank you. Okay, let me see if there's messages I've missed. If I have, you can always type it again. I've tried to make sure I see them all. And then, so natural filler I love. Other skin treatments that I think to be mindful of besides your sunscreen and your retinoid, to be the most basic, do those 2 at home. But the kids are saying, shh, shh, shh. Other things that you can do are Aerolase laser. Anything I talk about, safe for all skin types and tones. Aerolase laser, great for acne, redness, hair removal, DPN, the little like moles you can see on my neck. I got them zapped a couple weeks ago. They're like shutting off right now. I had them all over my neck and like my face after my last pregnancy. We were talking about this on live the other day, like the ones that Morgan Freeman has. I had a bunch of those and zapped those off. You can do Aerolase laser, no downtime with that, safe for brown girls, and that gives you a pretty glow. You can do bio repeal chemical peel. I feel like that's the best for brightening and for a pretty glow without downtime. I'm going to probably do that tonight after I wash this hair. Microneedling for anyone with texture problems, anybody with trying to do more collagen stimulation, acne scars, hyperpigmentation, dark spots, is your microneedling with skin pin. And then hydrofacial, if you want to like deep cleanse your pores, if you feel dehydrated in your skin, you're always dry, especially this winter time, hydrofacial is really nice and no downtime with that. Okay, what can you do to soften a prominent brow ridge? So if you feel like it's this, and it's like really, if it's because you, one of my patients is saying, Ginille, you crushed it again. I just saw her for some treatments the other day. If you have those really strong, Botox here will stop that muscle group, this procerus, and then your corrugators. It'll stop those muscles from flexing so hard, and then it'll kind of make the ridge not as high. If the ridge is still there, you can do filler or the natural filler to soften that transition on the forehead. Okay, IPL thoughts. Araceli, be careful. So It depends. You really, I'm tread lightly. I say this because I have a lot of people of color that follow me. I do not recommend IPL, intense pulse light therapy on black and brown skin. So Latina, Asian, black, even if they're like, I'm light, I'm like, be careful just because it can bring, melanin from beneath the skin that we can't see up. So I would not do that and can burn. And I've seen over the years just being on social, black and brown women showing like third-degree burns that they've had on their face with IPL. If you are white, I will do it. And you don't have like a ton of sim damage, I will do it. But in our office, I treat everybody, so we don't carry IPL. I would just say be very mindful with that. If you like to more volume on my cheeks, avoiding filler, what do you recommend? The natural filler. So that will help revolumize, give you new collagen over time. Natural filler is made completely from you. Other things that you can do that are not traditional hyaluronic acid filler are Radiesse, it's another injectable, or Sculptra, it's another injectable that is a collagen stimulator. What's the best treatments to reverse wrinkles in the neck and beneath the eyes? So sunscreen, retinol is really helpful, and then wrinkles. Is it the horizontal lines, or is it like vertical, like sagginess? Let me know. Botox will help tighten in the neck. If it's these lines, when like you can see on my neck here, you can do a very, very thin filler in them to soften them. If they're really, really deep and you have like a really full neck, I wouldn't do filler there. Beneath the eyes, a little bit of Botox. If it's when you smile and you get these little creasing, Botox. If it's hollowness, your natural filler or regular filler. Okay, let me see if I'm missing any. If I miss it, guys, please help me. Okay, I did my nose 2 years ago. It still looks amazing. Oh, thank you. I'm trying to see this. I hope you're doing so. Just want to let you know the uneven tip stayed even. Oh, thank you so much for sharing. God bless you. I appreciate that. I have seen quite a few people back for nose follow-ups recently, and they're like, Ginille, you did my nose 2 years ago. You said come in at two years. But they're like, it still looks great. I'm like, oh, we don't need to do anything. But should we do more to keep it up? I'm like, no, just keep it. So I'm really happy to hear that. Thank you so much for sharing. And you're so beautiful. God bless you. Okay. You don't have to do natural filler, but don't you have to do a natural filler a few times? Yes. A year and maintain it? Yes. So any of these things I talk about, guys, there is nothing in aesthetics that is one and done. Even when they talk about surgery, like people will get their surgeries done again. They're like, oh, I got my breast done again. It's been this many years. Or I got another facelift. So anything I talk about, especially when it comes to non-surgical, it's all going to take maintenance. So then you just have to decide, like, how much do you want to maintain? Some people are like, I stay on this. I'm going to do this because other people are like, I do this once a year. So it's really your preference, what your goals are, how you're naturally aging, what you're doing at home to maintain. That's a big part of it. If you can help like maintain, like healthy lifestyle choices are huge for how we show up on our face. Just your skincare with your sunscreen, your retinoid is big. Okay, horizontal. Oh, she was saying the horizontal necklines. So there, a thin filler can help. Yeah, that's what I would say. Yes, I heard that my injector recently recommended, but I don't know. Thank you. Araceli, let me see if I can see your picture. You look Latina. I would not do that, period. I mean, I can't tell 100%, but I would be careful about that IPL on you. You look amazing. Can't tell if I've done work. You're so kind. Thank you, Dragonfly. I've done so many things, and I can talk about all of them. So that was me at 28. This is me at 38. This is after I had my first kid. He's now almost 11 in a few weeks. And I felt like super sunken and hollow after having the fat sucked out of my face. And I have 3 kids, and I have breastfed them all, and I always look really sunken and hollow. I'm still breastfeeding right now. I don't look like this, guys, because this time around I've been doing the natural filler. I can do it. I mean, it's because it's just nothing is mixed inside of it. It's made from my own blood, and just in all the areas where I usually use volume. I do under eyes, smile lines, the cheeks, the temples, the chin, the corners of my mouth, and that has really helped so I don't look so haggard. And again, people are like, you don't need, I'm like, none of us need it. Somebody was saying to me the other day, you don't need Botox, you're too young. I'm like, dude, I'm 38. I'm like almost 40. I know it's not like super old, but like I can tell signs of aging on myself. None of us need this, you guys. Like, you are beautiful the way God made you, and like shine God's love and light without Botox and filler. You don't need it. However, I'm like, if you decide you want to do something, make sure you do it right. You don't want it overdone. You want it to look natural. You want it to look fresh. You don't want it to look weird. I'd rather you look old than weird. So that's, yeah. Somebody said I had a baby after 30. Yes. I'm 38. And so I guess it was 36. I mean, I would have 2 more if my husband would allow it. He is like No, we are struggling as is. We're not struggling. I mean, a little, yeah. I'm in Vegas. I need to come see you. I did PDR under eyes. Yes, come to Vegas. We have a whole office on the Summerlin side, and we have a great team there, and I see patients out of there. Smile lines, you can soften, and I'm going to try to make sure I didn't miss any questions, but smile lines, you can soften with the natural filler, traditional filler. Remember, when we're doing this, we don't want to just treat the line, and we don't want to do it too much to make no line. If there's no line, you're going to look puffy, blown out. You don't want that. Also, when we're treating smile lines, why is this here? This is because we're typically losing volume here in our mid face. So sometimes we're also treating these other areas. You don't want to just have a flat smile line, but your cheeks are saggy. It's going to look a little off. You also want to think about the corners of the mouth. If you just have a flat smile line and then these are deep, saggy cheeks, it looks weird. We don't want to look weird, guys. We see enough people walking around the streets looking weird. It's not worth it. Life changes for women can change. Oh, sorry, I'm going fast. Life can change. This is a great option for women who want to maintain dragonfly. Yes. Treatment for Dr. Ali. Treatment for forehead wrinkles that isn't Botox. I had an allergic reaction. Did you try another brand? So in the US, we have several brands. We have Botox, Dysport, Xeomin, Jeuveau, Daxify, and then Letty Bobo is like a new one. So there's like 6. I mean, I don't know, perhaps try, but maybe tread lightly if you decide that. Other than that, I would say not trying to just trying to tell yourself, don't make your expression so hard. And then, your regular sunscreen and retinol is always going to be my thing. You can also do for like the fine lines, if they're starting to get etched in, you can do microneedling, you can do the bio repeel, chemical peel. So any of the skin treatments will help. Okay, I'm going to keep scrolling and see if I missed any. If you have questions, please let me know. Dark circles. If your dark circles are under the eyes and created from hollowness, then filler or the natural filler can help. If it is just, you're like, oh, I don't have any hollowness, it's just dark, I don't know anything to change the color of the skin. Like if I wear makeup, I will do it here, guys, only because it's still dark underneath my eyes, but it used to be sunken and dark. When the sunkenness is lifted, people will tell me, oh, my concealer can actually work, or it looks brighter because it's not catching that shadow from being sunk in. Okay, I'm going to see if I missed any. Thank you, guys. God bless you. Do I have Botox? Yes, I've done Botox my whole face. I love it. What should you do at home? Your sunscreen, your retinoid, red light therapy consistently, drinking a lot of water, sleeping on your back is good, because if you sleep on your face and your wrinkles, you don't want to do all that. Try not to make such hard faces. Those are some easy ones. Exercise, like maintaining strength. You also tried Dysport. Okay, yeah, I would tread lightly, Dr. Ali. Difference between difference between filler and natural filler. Regular filler, like hyaluronic acid or calcium-based filler, these are made from like a manufacturer. We have different ones that are FDA approved in the United States. So some are thicker, some are thinner, different consistencies that we'll treat on different people depending on the areas we're treating, how much fat is in their face, if we're trying to, go on their bone and have more augmentation versus just like a little bit underneath their eye or into the lips to soften. Natural filler is made from you. So we draw blood in your tubes, we spin it in the spinner, it separates out. If you guys have heard like PRF, PRP, it separates your growth factors and stem cells. We take that part and we heat it and cool it so it makes a gel. And it also helps those growth factors and stem cells stay in your skin longer than if you just did regular PRP without heating and cooling it. So I love the natural filler. It is like one of the biggest things that is requested in our office and that we do in our office. I say the patients in their 20s to 40, 50s really like it. 65 plus, it's like a little iffy on results because I'm just like, we're depending on your body making new collagen in these areas. So natural filler, I really love. I think you will like it. You can do it all over your face. I've treated people's whole faces. I've done my temples, my under eyes, my smile lines, the corners of my mouth, the chin. I've done my cheeks, my whole face with it. So okay, would you need hip filler? Would you need a more dense filler? Depends on like how big that, are you saying hips or lips? Let me know. If it's really like indented, yes, I would say probably Radius or dilute Radius, where Radius is a calcium-based filler, mimics bone. I like it on jaw lines. I like it on cheeks when I'm trying to get augmentation. I like it for women of color that have more fat in their faces. But you can thin it out a little bit and you can put it in all over the body to make new collagen. Okay, Let's see. Is there a risk of migration with a natural filler? No, you're not going to have. I've had no issues with anybody saying anything with a natural filler. It's because it's made from you. So I'm like, this is, if what happens, I tell people, I'm like 3 to 5 days. It's going to look overdone. It's going to look weird, like you got botched. Not even that bad. It's just going to look overfilled for 3 to 5 days. And then it settles. I've never had anybody, any lumps and bumps lasting, nothing. Like I ask them all the time, what was going on? Like after 3 days, it stopped. Like the swollen went down. I should show you guys some pictures of me swollen. It looks a little weird, but then it goes down. And it gets better over time as your body's making new collagen in those areas. So low risk for any weird thing happening besides some bruising and swelling. Okay, let me make sure, see if I'm missing any. Would I recommend a certain amount of weight loss before filler in the face? Chanel. And they said, is a natural filler PRF? Yes, PRF, but heated and cooled, so it makes a gel out of it. Certain amount of weight loss before filler in the face? No, everyone's different. Everybody right now, a lot of people are like losing weight with the help and support of GLP-1s. So people come in at different points. Some people are like, hey, I lost all my weight. I've had one person, I lost 100 pounds. I've lost 50 pounds. I've lost all the weight. And now I'm happy where I'm at my goal, but I'm noticing my face looks a lot sunken and not lifted. There's not much fat in my face. So that's when we're starting their plan of doing their filler. Other times people come to me and they're like, I'm in the middle of my journey and I'm planning to lose 20, 30 more. But I've already lost some, but I'm already seeing these aging and my cheeks don't look lifted and I don't like the way it looks. And so I talk to them like, hey, do you want to wait or do you want to start now? Some people are like, I don't like the way I look right now. I need something to let's get going because I don't like the way my face looks. And so that's when I say, hey, we can do some. We don't want to overdo it. We're going to do it. Get you to a point where you can feel fresh and look fresh and we can see the change, not overdone. And then we can reassess as you get to your weight goals because your face may continue to change after you lose another 20 to 30 pounds. So we just keep that in mind as we approach it. We might also do like collagen stimulators, the natural filler. So it's like making new collagen, or we could just be doing filler to give them that instant boost or a combination of both. So it's really dependent on the person. Do I do PDGR, PDGF? No, I don't. That is not FDA approved for injection in the United States. Anything I do, guys, I went to Stanford, I went to Duke. I'm not playing around with these degrees. I'm not playing around with my license. I'm not playing around with my patients' faces. I'm not playing around with the license of my other team members. So anything we do is FDA approved, and there's a lot of thought behind treatments I bring in the office. I also am on here making videos and talking about this stuff all the time. Like I could never in my heart tell you guys something that I don't think is right to do. That may end up being like a great treatment for people in aesthetics, but it's not FDA approved to use right now. So we don't want to be doing that. Also, heads up, guys, like when new stuff comes to the aesthetic market, don't be the first one to try it out. I am super slow to bring stuff on into the office because one, I want to make sure it's safe for all skin types and tones. Again, I see a lot of people of diverse backgrounds in our office, and in these clinical trials they're not always trying it on all skin types and tones, or they're doing very few people of color. So I want to be like, how does this perform in all faces? A thicker face, a thinner face, a thicker lip, a thinner lip. I'm thinking about all that when I do it, and then I just kind of let the dust die down. So a lot of the companies will come in and they will put a lot of marketing dollars and hype up their new product and get everybody talking about it and put money behind big injectors and stuff. So then they're talking about it and make it sound exciting. But I'm like, I need to see the results. If I can't get the result, it doesn't matter to me. Like, I don't care who's doing it until I see the results multiple times over. And then I need to see the results 3 months, at 6 months, at a year, at 2 years, before I decide to be like, yeah, I'm going to put my name on it and tell people I think you should do this. And I've tried this on myself and I've tried this on friends and family. So that's how I do when there's new stuff in the aesthetic market. We just want to be mindful. There's always new stuff, guys. I've just been in this since 2013. So I've seen things like come and do nothing, or come and do harm, and come and go, and you don't want that. I've also seen things come and be great, but we just want to be mindful. We want to be slow. We don't want to just be willy-nilly about what we're doing. Virtual consults tomorrow. I'm so excited. I can't wait to see you. We'll go through questions, your goals, tips on what to expect, how to prep for treatments, all the things. Yes. When do I come to LA? I live in LA. So I see patients primarily in Los Angeles. I have a clinic in Vegas, so I go there and I see patients as well. But I have team members at all the offices, and they're excellent. We share the same philosophy of injecting and approaching skin health, hair hair health. We all treat all skin types and tones. If you come into our office, you're gonna see everybody walking in there, and like that's it. And if you see our patient before and afters, you're gonna see everybody. Like that's the goal. How effective are lipo shots for targeting fat? Lipo shots, I don't know if you're meaning Kybella. That's a way to permanently dissolve fat. It works. It just takes a lot of it, and it's not quick. Or I don't know if you're meaning like Ozempic, Zepbound. We do all of these things in our office. Zepbound works really well for weight loss overall, but it's not like targeting a specific fat area. Where is the location in Los Angeles? We are in Mar Vista, and then we're in Torrance. So we got 2. Pine Bottle. I don't know what Pine Bottle is. Girl, I only play with stuff that's FDA approved, so I don't know. I don't know what it is. I don't know. And sometimes I have people here talking to me from other countries. So other countries, I don't know all this stuff. Okay. Recommendations for hooded eyes. So if you feel like this is low, you can try some Botox around the eye. So Botox, this muscle around the eye is a circle. When we Botox here, it'll give a subtle lift. It's not like that, but it'll give a little bit. You can also try collagen stimulator or filler or natural filler into the temples to support if your temples are like hollow or sunken. Sometimes putting, product here, filler, natural filler here will give a little bit of support where the cheek looks lifted and pulled back and the highlight is up, and it kind of gives, it's not going to like lift your eye, but it helps make this illusion of a lift. If it is really just excess skin there, that might just be a surgical thing. So I kind of have to see it. And it could be a combination of multiple things. When people are doing these treatments, it's not always just like one thing and that's it. I'm trying to scroll and make sure I didn't miss anything. If I missed your question, please just like say it again. I have hollow under. I tried Easy Gel once, didn't see results, so I tried again. So Brandy, that is why we do it in our office in a minimum of, oh, these kids, I'm gonna have to go in a minute, of 2 sessions. I know you guys hear that. That's the little one. He's crazy. And he does not let me stop feeding him. I'm like, you need to stop, that big baby. I'm gonna have to go in a minute. We do it at least 2 sessions. We stack the 2 natural sessions, Easy Gel, back to back, a month apart. It can take more though. So it depends on the person's age, their health, how hollow or deep they are. I'm gonna have to go. My husband can't watch these kids. He can't do it. I'm in LA. I would love to see you. We don't offer threads. You look gorgeous. Oh, thank you so much, Nick. I hope you're doing great. If it's not giving you enough of the lift, and remember, it can take up to 6 months to see the full results for your natural filler. You can always consider filler if you're a candidate for it. So it really depends on the patient. You guys heard all that hollering. Okay. He's crazy. Okay, I gotta go. All right, if you think of others, message me. You can DM me. I'll respond there. Or like fastest way is the number. Call or text that number. I'll be back on here. I appreciate you. God bless you guys. Have a great night. He's struggling over there. When you say filler is too much, like how often in between sessions? When I do filler, wait 6 to 8 weeks before you retreat the same area. Natural filler, you do your second session a month apart. Okay, I will talk to you guys soon. You can write me questions on there. Thank you so much. Have a good